Okay, in this lesson, we're going to discuss something that can drive all of us crazy: repetitive questions. All of us that are caregiving for someone with dementia have probably heard over and over again, where are we? What are we doing? Where is so and so? Where is my purse? Any of those things, those questions just keep coming up and coming up and coming up, and you answer and answer and answer, and it doesn't seem to stick. What we have to remember in these situations is that your loved one is trying to make sense out of what's going on. They can't necessarily remember sometimes where they are, what they're doing, what they're supposed to be doing. They may be worrying about something, and they're asking you to try to make sense of what is happening. And you have to remember too that the part of their brain that is responsible for storing and categorizing new memories is likely gone at this point if they're asking these questions over and over again. So they're not going to remember your answer no matter how many times you try. But there are some simple tips on how to handle these repetitive questions. The first and most obvious is just to keep answering them. Even if it drives you nuts, just keep answering. It'll give your loved one that answer they need, and maybe for a couple seconds or a couple minutes, they'll settle down. Another great tool to utilize is notes. I know when Kim took her mom to France when she was kind of in the early to moderate stages, she would put Post-it notes all over the place. Say, okay, today is Tuesday, we are going to go to the Louvre, these certain things, and her mom would be able to orient via those. Other things that can help are whiteboards or daily calendars and schedules. One of the good benefits with these too is you can involve the person in finding the solution. And after a while, sometimes they can learn to say, okay, I'll go check the calendar. You do have to make sure the days are crossed off right and things are written in a way that they can see, but they can be very helpful. I had a gentleman in my program. He did not have his cell phone that day because they had left it at home on the charger. And, every 5 minutes he'd pat around and feel for his cell phone and then stand up and, start looking for it. So we'd inform him, over and over again that he didn't have his cell phone today. It wasn't lost. His wife knew about it. But what I actually ended up doing is he was sitting there doing some Sudoku. So I took a whiteboard and I set it up kind of on the table in front of him. And it just wrote on there that, Pam has your phone. So when he'd start getting antsy, he'd look up and immediately see that and say, oh, so this person knows who I am. They know what my trouble is. And they've got a solution, so he wouldn't have to worry about it. So it'd just be, quick and instant. He would look up and orient and say, okay, she's got the phone, I'm okay. Sometimes, if it is super repetitive, you can kind of throw a monkey wrench into it and give an odd answer. If they say, where are we going, you can say, we're going to go water skiing. And then you can start and use that validation therapy and kind of start a conversation about water skiing or boats or different things like that and get off the topic, and then they become less fixated on that one thing. This happens a lot when people are bored or not engaged. If there's nothing going on, if they have those lulls in the day, that's when we see a lot of these questions and things coming out more so. If somebody's engaged and happy and doing things, then it happens much less. So obviously it helps to keep your loved one engaged or give them a task. Give them a duster, give them laundry to fold, give them a game that they enjoy or a puzzle. Those kind of things can help keep somebody busy enough that they're not having to answer those questions or ask those questions. And you can also solicit their help and engage them in answering the question for themselves. So like with the calendar example, if they're asking when Dave's going to be home, you can say, okay, well, let's go look at the calendar and see what it says and involve them in that process. And hopefully maybe sometime down the road, they will learn to incorporate that calendar, check that calendar, and use that to answer their own question. Another thing that can be helpful is just something to keep their mouth occupied, like gum or a sucker or a snack. I had a gentleman in my program years ago who every 5 or 10 seconds, he'd say, what? Keep doing that over and over again. I think he had really sensitive hearing, so he'd pick up on other people's conversations just a little bit and kind of try to respond to them. But even something as simple as giving him gum so he could chew and keep his mouth occupied, it dramatically reduced the number of times he would say what. It was very helpful. So those are some quick tips on how to handle repetitive questions. We will see you in our next lesson, which is all about the delusion, paranoia, and hallucinations.